I was like, I didn't save your life. He said, no, you did. I said, I couldn't have. He said, no, you did. I said, I did not. He said, you guys saved my life.
My name is Anastasia. I'm 24 and I'm a makeup artist.
I am Ikenna Otu, a Nigerian from Imo State. I work with Federal Road Safety Corps.
In December 2018, I could remember vividly on 31st, which was crossover. I was full of life.
Before falling ill, before everybody in the house fell ill, we drank gari, that is the cassava flakes, and that was the gari we bought from the market. That was the last thing we ate that made us fall ill.
In February, that was when I had the symptoms, and it came like malaria. I thought it was malaria.
I started, I started having abnormality in my body.
And my mind went to a rice mill because I bought rice that period. And when you are buying rice direct from the farmers, from the mill, at times you put it in your mouth to test, to know how crispy it is, how good it is. So my mind keeps going to that place.
I think that is the only thing that can bring that disease in the house.
It was so severe that even when we are together, sleeping, they will be shouting in pains. I could not even attend to them because I was down with pains, body pains.
A PCR takes 24, 48 hours for us to have results. And sometimes when the result takes time to come, it's going to impact negatively on the management of patients.
My body was shaking. I was vomiting. My urine, in fact, the color almost like black even. So that was when I knew that, man, this is a serious thing.
So I was in emergency. After everything, they told me to go back home. I went back home. After 2 days, I came back. I was pleading with my people, please, admit me, I'm not getting it.
So I would hear them attending to other patients. While I was there, nobody will attend to me from morning to evening. So at a point, I complained to one of the young doctors who now said, okay, let me just give you a secret, but don't confront anyone. I overheard one of the nurses saying that I'm scared of entering that room because I don't know if it is Lassa.
Many people think of Lassa fever as a disease of the poor.
So when I was tested positive for Lassa fever, I was shocked to the bone because I don't know where it came from. We thought it was the normal malaria and typhoid, and Lassa fever. So
I felt strange. I felt everything was just strange. I've never been in the hospital. I've never been admitted in the hospital. So it just felt weird to me. I thought I was really in the nightmare that I was gonna come to an end. It was a horrible experience.
Lassa fever for me is one of the neglected diseases. Until 2018, there was a huge outbreak here in Abakaliki that attracted even the attention of WHO.
In the political sphere where decisions are made and all of this, it's still very much neglected. Very much neglected.
As a doctor in Nigeria, I remember when I was in medical school, we were taught of viral hemorrhagic fever, including Lassa fever, Ebola fever, dengue, and all that. But I remember in medical school days, the page for Lassa fever topic was just one page lecture that we were giving on Lassa fever.
And then there is something that most people believe in when they are sick. They say, it is also wishes and wizards pursuing them. So we have to get rid of that kind of idea, outdated idea.
Before MSF came, Lassa fever was more like a death sentence. If anyone had Lassa, the staff would generally abandon the patient. Not because they don't want to take care of the patient, not because they don't care, not because they are not concerned, but because they don't have the tools they need, like the PPE, things they need to take care of this patient, the space that
Every clinician, every practitioner of medicine in the hospital setting should see any disease condition as a potential Lassa fever case, especially in endemic areas like Abakaliki. We also have endemic area in Irua, Edo State. We also have a place like Ondo State, another state in Nigeria.
In the hinterlands, in the rural areas, there should be correct public awareness for people to know that this thing, one, it exists, all right? Then it is treatable. Treatable depends on when you present yourself for treatment.
To always take precaution, because prevention is always better than cure. If possible, avoid eating any food that is not properly cooked. Disinfect your house, clean your surroundings to avoid that rat that usually spread the disease.
MSF is collaborating with this hospital called Alex Ekwueme Federal University Teaching Hospital. Now, there is a virology center where samples are run, especially for Lassa fever patients, using PCR, just like as we have for malaria, HIV, hepatitis B, hepatitis C, and even cholera. We don't have a rapid diagnostic test for Lassa fever. Now, one of the new initiatives we are conducting with the lab here in FETA is to see if the RODT, rapid diagnostic test, could be a substitute for PCR in the management or diagnosis of Lassa fever.
Health promotion is a continuous thing. So we have to keep working until the time of the outbreak and then keep preparing the people who give health talks in the villages and have community engagement. And this purpose of all this is to foster behavioral change. And behavioral change would help. It's not something that happens immediately. It's something that takes time. And the Borno State has 13 LGAs with numerous villages and lots of people. So we take them one at a time to ensure that everybody gets the message and everybody assimilates this behavioral change.
I was in a private hospital where they were treating me of malaria and typhoid for about 3 days. I know that if I had reported early, it wouldn't have been that bad.
At a point, I got scared, knowing that somebody can die from it as well.